Hello everyone, this is Dr. Davis, and today I'm going to talk about anxiety, not only in theoretical terms, but what you can actually do when things begin to spin out of control. I think you'll find that controlling a stressful situation or even a panic attack can be easier than you think. So I'll jump straight to it, enjoy the video, and I'll talk to you on the other side. I can't breathe, my heart races, I can't think, and I feel like something terrible is going to happen, and real soon. This is the reaction of Sarah, one of my patients, when she is about to have or is having a panic attack. I've had one of those myself, and I can attest that it's no fun at all. Panic attacks have a genetic connection, and of course are related to stress, but recently studies have found that the actual underlying cause is a problem of acidity, or pH balance, in certain places in your brain. Here's where your amygdala comes in, a small, deep structure that has an important role in the circuits that control fear. That includes the instinctive fear we have of predators and the learned fear from negative life experiences, even if they're imagined. The amygdala then sounds the alarm and notifies the prefrontal cortex that then tells the amygdala whether the alarm is justified. This is the region where the balance of acidity is critical. Research has also shown that carbon dioxide, or CO2, will act as an acid in the amygdala, and that people with panic disorders will experience a panic attack when breathing higher levels of carbon dioxide than other healthy people. Breathing is a central issue here, and it's the body's built-in stress reliever. When we're stressed, our heart rate increases along with our breathing, and the blood is diverted from the gut to the muscles so that we can run away. So the stress response is actually an asset. But when stress continues, we breathe too rapidly, and the imbalance of CO2 will decrease blood flow to the brain, causing cognitive problems and emotional havoc. This is the reason why it's sometimes suggested to breathe into a paper bag. You rebreathe your air and return your CO2 back to normal. But there's another option. I call it 4-6-8 breathing. It's simple and doesn't require any tools or equipment. First, you sit or stand in a relaxed position and breathe out with slightly pursed lips. Then, you close your mouth and breathe in through your nose for 4 counts. After that, you hold your breath and count for 6. Then you exhale through your mouth for a count of 8. All of this will be a total of 1 breath. Repeat the cycle 4 breaths, and remember that exhaling takes twice as long as inhaling. And if you have trouble holding your breath for that long, you can shorten it. Just make sure that the ratio is always the same. The slow, long breathing is a tranquilizer for the amygdala and can even be more effective the more you practice, unlike most of the drugs for society. Try to do this at least twice a day, but you can do it every hour if you need to. Once you master this technique, it'll be a very useful tool for any stressful situation. So before you fully react to an upsetting event, just start the 4-6-8 breathing. You can even use it when you sense internal tension or as a helpful pre-sleep routine. Many people find that the 4-6-8 breathing exercise has changed their lives for the better. I should note that panic attacks can be complicated and affected by stress hormone levels, thyroid problems, inflammation, lactic acid, and chest wall restriction. So if the 4-6-8 breathing helps but doesn't solve the problem, contact our office or a doctor you know that understands the subtleties of breathing on the nervous system. Health is on the way.